Hi everyone, my name is Kylie and today I'm going to present to you vitamin E. So today we're going to go over these many different questions. What is vitamin E? Where do we get it from? How does it function in the body? What is the recommended dietary allowance and upper limit? Who's at risk for deficiency? What are the symptoms of deficiency? And can vitamin E be toxic? So, what is vitamin E? Vitamin E is a fat-soluble vitamin that also acts as an antioxidant within the body. We can get these from many different food sources. According to the National Institute of Health, the best sources for vitamin E come from nuts and seeds, such as peanuts, almonds, sunflower seeds, and even peanut butter. We can also get it from plant oils, such as wheat germ, sunflower, and safflower oils. You can also obtain this vitamin from fruits and vegetables, such as spinach, broccoli, sweet potatoes, apples, and mangoes. You'll also find vitamin E in eggs, margarine, and fortified cereals. How does this function in the body? Well, it acts as a fat-soluble vitamin, meaning that we need fat in our diet for this vitamin to be absorbed. So it helps with breakdown of vitamin A and unsaturated fatty acids. Also prevents in the breakdown of cell membranes. The recommended dietary allowance would be from birth to age 13, you would get 4 milligrams to 11 milligrams, which is equivalent to 6 international units to 16 international units of natural form. Adults get 15 milligrams. Breastfeeding women need 19 milligrams. So, the alpha tocopherol, which is the most purest form, is equivalent to 22 international units, which is the natural form, and 33, which is from synthetic form. The upper limit is going to be 1,500 international units from natural sources from your diet, and 1,100 from synthetic sources, such as supplements. Who's at risk for deficiency? Well, premature infants are at high risk for deficiency, and this is because vitamin E is transferred within the late stages of pregnancy from mother to baby. Now, premature infants are growing quickly and they have high demand of oxygen, and as we learned before, the vitamin E helps with cell membranes. So, cell membranes are also on the outside of your red blood cells, and babies need a lot of extra red blood cells for their high energy and oxygen demands. So they're at risk for putting stress on those red blood cells. Smokers, they found that smoking eliminates the vitamin E in the lung, and even high doses cannot replace it. Like we said, we need fat to absorb our vitamin E, so those on low-fat diets or those with fat malabsorption will have problems absorbing their vitamin E. Some of the symptoms that can occur would be nerve and muscle damage, which could lead to loss of function, loss of sensation, and trouble with coordination. Other people can experience weakened immune systems, and again, even adults can have hemolysis of red blood cells. Toxicity and symptoms. So, according to the National Health Institute, toxicity is not likely from our diet, but rather than from supplemental sources. Now, I've learned that if you take more than the upper limit, you are at risk for hemorrhage. So, this is because vitamin E interferes with the metabolism of vitamin K, and therefore your clotting mechanisms are not as effective, and you're at risk for bleeding out. Other symptoms can include muscle weakness, headache, nausea. Some of the off-label uses would be for skin care, hair care. I found on livestrong.com that you can mix vitamin E capsules with a little bit of olive oil and apply it directly to the skin. I personally have done this when I was pregnant to help reduce stretch marks. Overall, vitamin E is a fat-soluble vitamin. We get it from many of our food sources such as nuts, seeds, sunflower oils, avocados, and asparagus. We went over the recommended dietary allowance upper limit. You now know the deficiency and toxicity symptoms, as well as some off-label uses. Thank you. Hope you have a great day.